It was a wonder drug given to pregnant women on the NHS for nearly 4 decades until it was banned in the 1970s for causing irreversible harm to their unborn children. Yet that devastating damage has continued to pass through the generations, and now the women whose lives have been ruined are seeking justice. But how many are there, and will their health problems be passed on forever? I'm Daniel Hewitt, and this is what you need to know. I'm joined for this quick briefing by our social affairs correspondent Sarah Corker, who's been looking into this devastating story. Sarah, take us back to the start. Where did you first hear about this issue?
Well, it was about a year ago, and it was part of my ongoing investigation into the forced adoption scandal. And as part of that, we've spoken to dozens of women all over the country. Now, their stories are shocking and devastating in their own way, in terms of they were unmarried mothers who were sent away to mother and baby homes because they were pregnant outside of wedlock in a time when that was the ultimate social taboo. So they were pressured, coerced, forced to put up their children. I interviewed lots of women about what they'd been through. And it was one particular interview nearly a year ago when at the end of the interview, the cameras had stopped rolling and we were just having a kind of more relaxed chat. And this lady said, oh, and you know what else they did to us? They also prescribed us, forced us to take whatever wording you want to use, a drug that dried up our breast milk, but that's been linked to cancer. And I was pretty astonished by that because, I'd been investigating this scandal with the forced adoptions for many, many months, and no one had ever mentioned this drug, and it's almost a scandal within a scandal. And from then on, I started investigating. I had no idea about it, and what we've discovered, certainly the scale, is pretty astonishing.
So what is this drug? You mentioned drying up breast milk. What was it about?
Yeah, so it's a bit of a mouthful. It's called diethylstilbestrol, commonly known as DES. Now, it's a synthetic hormone, and it was invented in the UK, actually, in the 1930s. And back then, it was very much kind of marketed as this wonder drug. It was used around the globe to treat a variety of issues, including postnatally to dry up breast milk as a lactation suppressant. But it was also used kind of more widely to treat pregnancy complications, so to prevent miscarriage. And women that we've spoken to have said they were given this drug in pretty high doses in the first 3 months of their pregnancies. Some said they were given multiple tablets a day, others were injected on a weekly basis. And so we found out that so many women were given this drug, not just in these mother and baby institutions, but in hospitals, at the GPs. And it was used for all sorts of things. Yet there were warning signs from the 1950s onwards that there could be some really sinister side effects. And the more we've investigated, the more women have got in touch. We've had more than 100 women get in touch with us just in the last few months, saying they believe that they may have been exposed to this drug and they feel they have nowhere to turn.
And the drug was banned in the 1970s. You mentioned there were warnings from the 1950s. In the end, what was the reason it was banned?
The mothers who were given this drug in high doses, there seemed to be this increased risk of breast cancer. Doctors, public officials were kind of making these warnings over the years, and yet the drug was still given on the NHS for another 20 years. So it was these warnings in the 50s, but it wasn't banned in the UK until 1973. But it's not just the increased breast cancer risk. The actual reason it was banned in 73 was because there was a study by scientists in the US that found this link between DES exposure and rare types of vaginal and cervical cancer. So links to multiple types of cancers. And what we know by speaking to the medicines regulator is that in 71, this link was confirmed as much as it ever can be when it comes to these types of medicines. And then in 73, they wrote to doctors in the UK to say, you must not use this drug in this way to prevent miscarriage or for premenopausal women. Yet, we have been contacted by women who say they were given it as late as 1980.
The thing that shocked me about this was the fact that it doesn't stop with the person that took the drug. The effects of the drug are passed down the generations, passed on to their children. I mean, that's the element of this that when you found that out, must have been that's the shocking bit of this, isn't it?
That's right. The drug may have been withdrawn in
Yeah.
the 70s, but the legacy is really far-reaching, and the harms, as you say, are passed down the generations. So those who were exposed to DES in their mother's womb are known as DES daughters and DES sons. And a lot of them feel they have a range of issues that may be connected to that exposure, including infertility, internal abnormalities with their reproductive system when it comes to women, and also an increased risk actually of miscarriages, as well as those increased cancer risks. Now, I've been speaking to kind of dozens of women. A lot of them get in touch with me, not because they want to go on television, but because they want me to understand what they've been going through. And they want someone to listen, because they've been trying to talk about this, to get this on the radar of politicians for decades, and nothing seems to happen. Now, I went to meet one woman, Suzanne Massey, in Liverpool. She believes her mother was given the drug when she was pregnant with her, and she has had a lifetime of health problems.
I was in hospital for a procedure every single year for the last 25 years. I've been in horrendous pain at times that's taken my breath away.
What would it mean to you to meet other women who have been through a similar journey and to know that you're not alone?
It would be the answer to my prayers. I've been waiting 25 years for this.
She's been trying to speak to doctors about this for years, and she feels it's just not been taken seriously. And this is the first time she's ever spoken publicly about this. You know, a big thing, because she wants to raise awareness and she wants something to happen, and for others not to feel totally alone.
In looking into this issue, have you been able to come across any kind of data or information that says how many people have been affected by this drug?
Finding concrete, reliable figures is difficult, mainly because of the poor NHS record keeping, the casual way that this drug was given out over many decades. You know, we spoke to one lady who said it was almost given out just like paracetamol in the hospital. Nothing was written on their notes. And even those who did have it on their medical notes, they are often destroyed after 25 years. So trying to find that paper trail is difficult. But speaking to researchers and scientists, you know, in this country and all over the world, they estimate that in the UK, up to 300,000 women could have been exposed to this. And then globally, the numbers are staggering. Up to 10 million globally were given this drug.
So 300,000 in terms of people that would have potentially taken it. And in terms of how we stop this, I mean, passing on and passing on and passing on, is anything been done about dealing with these effects to kind of stop it in its tracks so it doesn't just keep going through the generations?
One of the things that women are certainly calling for is an enhanced cancer screening program, because, you know, the women are at increased risk of certain types of cancers, and they believe there's not those extra observations or screening at the moment to catch the cancers early. They say that is something that the government could do pretty quickly and easily to reduce the risk, and certainly to make sure that these women are monitored. They do that in Australia, that the women there are screened every year, and they want something similar here. But in terms of how far this goes down the generations, we're on the third generation now, but the true impact on them is still unknown. I had a chat with a scientist at the University of Chicago who has written a number of papers on this, and his view is that because of the age of the women, and also men who are exposed to this in their women's womb, because they're getting to kind of their 40s now, it's only 40 plus that some of these cancers emerge. So they're saying actually it's too soon to say. And then when it comes to the kind of fertility issues, it's often when people try to have families that these issues are found, really. And the problem there is that, you know, trying to then connect it to the drug causation is really, really difficult. And then women are trying to find out, well, what was my mum given it? Was she not? Sometimes the mother's passed away. So it's a difficult web, really. But I suppose what I'm trying to say is there isn't enough medical research into this area. It hasn't been looked into in the detail that many of these campaigners want.
And you've spoken, haven't you, to two women, sort of mum and daughter, who've both been affected by this.
Yeah, that's right. I went to Wiltshire and spoke to the Hall family. Now, they believe that 3 generations of women in their family have had health complications that may be connected to the drug. So Jan Hall, her mother was given the drug to prevent miscarriage when she was pregnant. She died 2 years later from breast cancer. Jan believes that may be linked to the exposure. And Jan is now worried about the impact on her daughters passing down. Jan's had cervical cancer in her 20s. She's now worried about her daughters. So we can hear from Hannah first and then Jan.
It's upsetting because we don't know, because there hasn't been enough research. We don't know going forward, am I going to transfer this down to have I transferred it down to my daughter? Is she then going to have issues? It shouldn't just be swept under the carpet.
It is an unusual thing that it carries generation to generation. Thalidomide did not carry generation to generation. Terrible though thalidomide was, it stopped at those children. This doesn't.
And what I picked up, certainly talking to the Hall family, was this general sense of frustration actually with medical professionals, because they want it on their medical notes that they are DES exposed so that GPs are aware. Yet they've said over the years, as they try to raise this, they just get a blank look from doctors who say, oh, I've never heard of that, I'll have to look it up. So that they're shocked actually that more medical professionals don't know about this. And I think it goes back to the fact that the drug was withdrawn so many years ago. Younger doctors won't be aware of it. It's not on the kind of medical teaching program. So by speaking out, one of the reasons they wanted to do this interview was to increase that public awareness of the drug.
The two obvious questions for me really are if more and more people come forward, they are at some point, I imagine, going to start forming a bit of a campaign group, if they're not already, looking into, yes, what can be done about it now, but also compensation here, the damage that's been done, and also what the government are going to do about it. So I assume the government are aware of this and it's not come as a surprise to them.
Well, there's a movement at the moment from a group of women who want to launch legal action against the government, because their view is that this was a drug prescribed on the NHS, that the warnings were known, that they weren't acted upon, and ultimately they feel the government bears responsibility. So they're at the very early stages of litigation. One of the big issues, though, is that, you know, around the globe, there have actually been hundreds of court cases and compensation payments in the US, in the Netherlands, in France. Here, there has been nothing. And one of the problems is that goes back to the poor NHS record keeping, but also because of the law here. So the drug was never patented. It was manufactured by 200 plus companies. And the UK law says that you have to know the drug company that manufactured that drug to be able to then sue. Well, people just don't have the notes. They're not going to be able to prove that. So in terms of product liability, that route for legal redress is certainly closed.
In terms of the government and their response here, has the Health Secretary of the Health Department, have they commented on their view on this in terms of listen to these families and what they have to say about it?
Well, we've been looking into this drug, really closely for the last couple of months. We put these concerns to the Health Secretary, Wes Streeting. He said that his department is looking very seriously at the allegations. And then his officials again said to me today that they are continuing to explore what more can be done to support those impacted. I mean, that hasn't gone down particularly well with campaigners, because they feel over the years politicians have promised to sort this out and no action has been taken. So back in the 90s, David Blunkett promised to get an enhanced screening programme for these women. That was when he was Shadow Health Secretary. Lots of politicians over the years have commented on this and pushed for action, and then nothing happens. So women feel quite let down, actually. And then one of the other kind of problems is that when we speak to NHS England and say, what are the guidelines, what should women do, they point us to GPs. They say the women need to speak to GPs about the risks. And then when we've spoken to the Royal College of GPs, they say, oh, there are no guidelines on this.
Okay.
So women feel they have nowhere
been passed around the system, essentially.
Exactly. I do feel we've been focusing on women a lot. Let's not forget about the DES sons.
Yeah.
Because there is some evidence, not as much as connected to the DES daughters, but some evidence that DES sons also may have some complications around fertility. We haven't had any DES sons come forward yet because it's a less talked about area, but I'm just conscious we've spoken a lot about women, but actually men are impacted by this as well.
And I take it anyone listening to this, you would very much encourage them to get in touch with you and the team about speaking about this, even if they don't want to speak on television.
That's right, because this investigation is very much audience driven. We've been astonished by the numbers that have come forward who want to share their stories, and it's those listening to this podcast who can direct us in the next focus for our investigation and what we should be looking into. So please get in touch.
It's just such a great example of the reason why public service broadcasting is so important, and journalism like this is so important, because you don't find stuff out unless you have these conversations, and your investigation to forced adoption is so powerful and so important, and it's so great that you're still uncovering these injustices, Sarah. Thank you very much for joining us. Really appreciate it. And if you do want to get in touch with Sarah and her team on any of the issues we've discussed today, you can get in touch with the Social Affairs team. That's socialaffairs@itv.com. And if you're watching or listening to this on a podcast platform or on YouTube, there's a link in the show notes to Sarah's article, which includes loads of links that you can go to get more information and support on these issues, on these really, really important issues. Do hit subscribe to ensure you never miss an episode of this podcast. But until next time, thank you very much for joining us.